Hello, everyone. I want to start out by thanking all of our viewers and welcome you all to Medical Student Grand Rounds. I'm Bryce Ringwald. I'm a fourth-year medical student and Vice President of Student Council. Medical Student Grand Rounds, it's a lecture series given by inspiring medical students. This series occurs on the first and third Tuesday of the month, starting at 12 p.m. via Zoom. And we will be having our last session 2 weeks from now on April 20th. We just concluded Women's History Month, and today we have a fantastic presentation lined up for you with Shannon Weber. She's going to be discussing how she created a women's health specialty clinic within the Columbus Free Clinic services to provide specialty women's care to these individuals. We also wanted to make you all aware of our YouTube channel, where you can view all of our past presentations. To do this, all you have to do is log into YouTube, search Medical Student Grand Rounds, and all of the presentations will be available. Be sure to subscribe to our page to get updates of when new lectures are posted. And during this talk, we are going to be utilizing the Q&A function that you can be found at the bottom of the screen for questions at the end. And throughout, feel free to put in questions during the talk, and then we will hopefully get to most or not all of them at the end of the session. And now, without further ado, it is my great pleasure to introduce nurse practitioner Caitlyn Hall, a provider at the Stephanie Spielman Comprehensive Breast Center, for today's introduction.
Well, thank you guys very much for including me and taking time out of your day to join us. I know this is a hot time, it's lunchtime, so thank you. Today, you are going to get to hear about the brilliant Shannon Weber, and she's going to speak to you regarding service learning and her leadership at Columbus Free Clinic. Shannon's originally from North Canton, Ohio, and first became a Buckeye during her undergraduate studies in biology. She subsequently worked as a clinical research coordinator in the Division of Cardiovascular Medicine and is now a fourth-year medical student at The Ohio State University College of Medicine. She has committed to an impressive variety of volunteer and research experiences during her studies, with a focus on my favorite, women's health, obstetrics and gynecology, and community health and prevention. She led the effort within the Columbus Free Clinic to start the first free student-run women's clinic in Ohio, and was awarded the OSU College of Medicine Alumni Society grant to support these efforts. Shannon will graduate in May and will very deservingly become Dr. Weber. She recently matched at Ohio State to continue her medical career and will start her residency in obstetrics and gynecology starting this summer. I couldn't be more excited that Shannon plans to be a caregiver and advocate for women's health as the focus of her career. And OSU is super lucky that she's sticking around. It's my pleasure to introduce Shannon Weber.
All right, thank you, Caitlyn, for that very kind introduction. So like she mentioned, my name's Shannon Weber, and I'm here today to talk with you guys about interdisciplinary service learning in a student-run free gynecology clinic. So I will, if I can advance the slide, I will start with just a few objectives to sort of guide our discussion today. The first thing I want to do is just give you guys a little bit more context about why we chose to start a gynecology clinic within the Columbus Free Clinic. I want to talk about the structure and sort of the logistical considerations that we thought about when starting the clinic. I then want to talk about the impact that the clinic's made since the first pilot one in June 2018. Then I want to switch gears a little bit and talk about learning in the free clinic setting just sort of in general, and look at some studies that have looked at interdisciplinary service learning in formal medical education. And then finally, I surveyed the students here at OSU-Com to see how they have been impacted by their free clinic learning experiences, and I have some data to review on that. So we'll go ahead and get started. So this is Columbus, Ohio, obviously. I put the pin right at Varden Clinic, so that's where the Columbus Free Clinic is held on Thursday evenings. A few of the other OSU-Com free clinics are also held in that space. I included these stats mostly to highlight this persons without health insurance under 65 years old, so this 9.8%, because all of our services are completely free of charge at the Columbus Free Clinic. This 9.8% of patients is the population that we primarily serve. So just a little bit more background about the free clinic in general before I dive into the gynecology side. So it is led by community board members and student volunteers. It's led by a student steering committee, and then volunteer providers and students serve in the clinic each Thursday evening. The gamut of primary care services are offered. It's kind of a mix between an urgent care and more of a chronic like primary care office. We are fortunate enough to have a formulary on site to provide some medications free of charge. And then we're also able to do lab draws through a partnership with OSU and Martha Morehouse. All of the services that we do are completely free of charge for our patients. COVID has sort of changed the makeup of the clinic a little bit. On an average Thursday evening, they'll see 30 to 35 patients in clinic in person. Telehealth has become a lot more popular as another sort of learning avenue and way to serve our patients in the era of COVID. So sometimes the number can be upwards of 50, 40 to 50. And then as you can see, it is an interdisciplinary focus clinic with students from all different disciplines and providers from all different disciplines as well on each Thursday evening. So initially, when we were talking about starting this gynecology clinic in the fall of 2017, we wanted to see if there was actually a need for it in the population that Columbus Free Clinic serves. The way that we did that was patients normally go to our website, which I screenshotted there for you. And on the click here to request an appointment, it links them to a document where they answer a whole bunch of questions about reason for their appointment and contact information. We just added a question to this questionnaire they're already completing about whether they'd be interested in getting any gynecologic services. The numbers from way back in 2017 showed that there was quite a significant need, but I thought it'd be more accurate to show that there's been 306 patient requests since just May of 2020, even with all of the COVID restrictions. So it's definitely a greater need than what we can currently serve. A big question that we had when we first started talking about doing this clinic was, why do we need another clinic that can provide gynecologic services? There's lots of organizations, especially in Columbus, whether it's Columbus Public Health or Equitas or any of the federally qualified health centers, Planned Parenthood, that can have some pros that necessarily we at the free clinic don't have. So some of those other community organizations can do rapid on-site STI testing and provide treatment right away. So they can wait for 30 minutes and get their test results and leave with medication. There's also a wider variety of contraceptive options, especially at a place like Planned Parenthood, where they can do implants or IUDs. They also have, most of them have sliding scales. So some of our patients would most likely qualify for free services based on the income cutoff. One thing that we noted for our population in particular is that for a lot of these places, there's limited hours during the day. So either it's just an afternoon one day a week, or everything's limited to just within business hours. So we thought that given that all of our services are free, that's one place where we sort of fit in to serve a different subset of the population. In addition, we also have evening hours. So some patients that might not have flexible work schedules, we can provide for them. There are some disadvantages to the way that we set things up because we send all of our labs to Martha Morehouse. There is a couple of day delay in receiving lab results. We are lucky to have that formulary on site, but some of our limited things like antibiotic treatments, for example, we don't have every antibiotic we could possibly need. So we can't necessarily send patients home with medication for every scenario. And then also this can be both a pro and a con. We're run by volunteers. So patients don't necessarily see or talk to the same student or provider that they saw in clinic. So the continuity to care can sometimes be a bit challenging. However, we have the same goal as those other community organizations of just improving gynecologic care access to all patients in our community. A few other things that we thought that we could provide a little bit unique is our interdisciplinary focus. So like Caitlyn mentioned, she was a go-to person along with Julie, who's another nurse practitioner, when we first had this idea in 2017. So from the beginning, this clinic was kind of interdisciplinary by design. We also have a really strong social work team presence in the Columbus Free Clinic, and that was a really important thing that we wanted to make sure was emphasized in our clinic. A lot of our patients have lapses in care for a variety of reasons, whether they're socioeconomic or financial, lack of insurance, lack of job stability, all those sorts of things. And there's a lot of things that our social work team could help these patients with. So we wanted to make sure we were providing for those needs as well as their medical concerns. And then this clinic also provided a new avenue for different types of providers, women's health providers, other family medicine providers, to kind of get involved in our free clinic in a different way. So just to talk a little bit more about some of the logistical concerns that we tried to address from the get-go, or that were brought up as concerns by the board. So a big reason why we were actually able to start this clinic was due to our OSU partnership. The ability to have the space and the labs and the janitorial staff, as well as some funds available for things like speculums and gowns, was absolutely critical to being able to do this. A big concern that was brought up by the board was the need to have like very timely and adequate follow-up. A lot of our, like, for example, sexually transmitted infection results need to be reported to the state board. And there was a concern that we needed to make sure that nothing fell through the cracks, and we had a system in place to make sure that didn't happen. That's sort of where my role came in on the CFC, the Student Steering Committee, was that my role, which has now been passed down a few times, is responsible for ensuring those timely follow-ups and mandated reportings. There was a concern about some of the skill level of students, especially like first and second year students that hadn't been in the clinical setting. So how we addressed that was creating an EMR template similar to like a dot phrase in IHIS, that students would just have all the questions that they need to ask right there at their fingertips. And then the final thing was, what happens if we get like a PAP test back and it has an abnormal result? What do we do from there? We don't have the means to do additional testing or colposcopy or anything like that. So we made it a goal to develop a relationship with OSU OB-GYN to make sure that we had an easy way to get patients the additional care that they needed. So I'm not going to read all of this to you. I just wanted to give you a little bit of a glimpse into the patient experience at Columbus Free Clinic. So after indicating interest online, patients, when they present to the appointment, will check in with a team of undergraduate volunteers. They'll be brought back initially by a medical student, and the medical student will conduct all of the history and physical exam to their skill level and ability. They'll then go out and present to the preceptor, the provider, which is typically a team of nurse practitioners, PAs, or physicians. And then both the preceptor and the student will return to the patient's room for all of the additional counseling and physical exam. The patient will then go get any labs or medications that they need, and then the patient will leave. If there's any labs that aren't able to be resulted that day, which are most of the labs, the student coordinator will then call the patient and follow up with all of those lab results and follow up with medications or anything else that the patient might need. So when we first started this clinic, our goal was just to make more of an annual women's health visit. So we wanted to provide sort of basic screening services with an emphasis on prevention. So we did PAP tests, STI testing, and providing mammograms were sort of our big focuses. Over the years, these services have greatly expanded. So initially, we were only able to provide PAP tests, STI testing, and mammograms sort of within the gynecology clinic itself, which was occurring like every other month. Since then, we've figured out a way, and because of the huge need that has been identified by patients, we've been able to do all STI testing and treatment on site and in the general clinic as well. So patients that come in on any Thursday night can just request STI testing, and we can provide that for them without it being a specific gynecology clinic need. We've also, the coordinators after me have made sure to develop a relationship with OSU OB-GYN so that we have a direct route to referrals and can get patients in urgently if needed. With our social work team, we now have resource bags to distribute to women with menstrual and hygienic products that they might need. We also now have oral contraceptives on an in-house formulary. We have 3 different types, actually 4, and can provide that to patients free of charge. And then the new thing is a prenatal telehealth counseling. So the goal is to get patients very early in their pregnancy, do a lot of counseling with them, and then use that note, that established care, to then link them to OSU OB-GYN more easily. And then finally, this specialty clinic model is what we're calling it. So creating this gynecology clinic that occurs on certain Thursday nights, separate from the general CFC clinic, which is more primary care, has been kind of duplicated in the psychiatry and urology clinics that now exist at CFC. So in the future, it's continuing to grow and expand. I think the biggest thing that's going on right now is a collaboration with Sanctuary Night. So Sanctuary Night is a nonprofit organization that serves women that are stuck in the cycles of prostitution on the west side of Columbus. They are moving into a new space and want to be able to provide medical care to some of these patients. So CFC is going to be involved in that. Because we're now offering more like oral contraceptive prescriptions, we are establishing a telehealth program to make sure that we're checking in on side effects before refilling patient prescriptions. There's a greater number of provider volunteers that we're trying to recruit, and especially establishing a more formal relationship with like faculty at OSU. And then finally, one thing that we've been trying to do over the past few years is collaborating with other peers working at other free clinics to either help them duplicate and make their own version of this gynecology clinic, or to just bring their patients into the CFC Thursday evenings to get their patients the care that they need. So I'll sort of switch over a little bit to some clinic numbers here that we'll run through. So overall, since June of 2018, we've had 17 total clinics, and that has served 161 total patient visits. In just the 2020 fiscal year alone, so that's only 55 of those visits, it's been estimated that over $17,000 worth of services were provided. I also included just the volunteer numbers there, and if you take those in total, over 100 people have volunteered in the last 3 years, which is awesome. In terms of breast cancer screening in particular, so Caitlyn has a great connection to the Stephanie Spielman Comprehensive Breast Center, and along with the James Mammogram Bus and an Ohio project that's called the Breast and Cervical Cancer Project that can provide free screenings. We've been able to do quite a few mammograms. The data is imperfect. We are a free clinic, so we've done the best we can, but in terms of bringing the mammogram bus to Columbus Free Clinic, we have completed 29 mammograms through that mechanism. The good news is from that diagram that most of the results have been benign or negative, but there have been a few incompletes that require additional imaging. But because of the collaboration with the BCCP program, all of the patients that receive these mammograms receive them completely free of charge, regardless of their insurance status. So we can also refer patients to mammograms at OSU through the general clinic. So that other screen that I showed you was just the 29 mammograms that had been completed at the bus when it was at Columbus Free Clinic. This is the number of mammogram referrals per year. So this is just referring to general OSU patients can call and schedule their own appointments. They are still free of charge through the BCCP program, but I just wanted to show that in 2020, even with all of the COVID restrictions and the drops and the closure for a period of time, we still had almost the same number of mammogram referrals as we did the previous year. And already we have almost half that number in just 2021 so far. In terms of cervical cancer screenings, we've done 106 Pap tests in these 3 years. Most of them, so that NIL is kind of the normal results. So most of them have been normal, but there have been quite a few. So a few repeat HPV positives and some low and high grade lesions that have required additional testing that we've been able to coordinate for patients. In terms of STI testing, we've done quite a few of those tests as well. The most common positive result we've gotten is gonorrhea and chlamydia. So actually 13.6% of the tests that we've done have been positive. We have quite a good process at making sure that we get those mandated reports in a timely manner because of this. As Caitlyn mentioned, we've received a few grants over the years, with the most recent being a Women's Fund of Central Ohio COVID grant, but a few Medical Student Alumni Association grants as well. We've done quite a few publications and oral presentations just based on kind of the work that we've done and the changes that we've made over the years. Like Caitlyn mentioned, we were the first student-run free women's clinic in the state of Ohio. So I think we've had a lot of opportunities to kind of share our model because of that. So this is just from that survey that I conducted with my peers at OSUCOM. So did you volunteer at the gynecology clinic? About a quarter of them said that they did, but what most stood out to me about this graph was the 30% of responses, so there were 56 total, that said that no, they hadn't volunteered, but they would have liked to. So I think that speaks to the interest in this kind of learning experience as well. I would venture to say that not all of that 30% necessarily wants to go into obstetrics and gynecology or family medicine fields that see a lot of gynecology. So I think that's a very good thing and something that we should consider when scaling up our opportunities. So I'm going to kind of switch gears a little bit and talk about not so much of gynecology clinic experience, but more so just free clinic service learning as a medical student in general. I have a few studies to talk about. So the first one is focused on interdisciplinary training. And it was a study conducted at the Medical University of South Carolina. Something that was interesting about this one was that it actually had an experimental and control group, which is very unique for this sort of like survey-based study. They designed an interprofessional elective with a variety of different health professions. And this elective had two different parts. So the first part was a series of lectures and activities and clinical skill sessions. And then also consisted of volunteering at the student-run clinic in these groups of interprofessional teams. So how their results were structured were that they looked at a few different surveys. So the two that I think are the most interesting are this IEPS, which is an interdisciplinary education perception scale. And those are the two questions associated with that. And then the third one, which is the SACRR, which is the self-assessment of clinical reflection and reasoning. So definitely mouthfuls. And it has a few questions associated with that. So the first one, the IEPS, is very much focused on students' perception of other professions and how they perceive being able to work with other professions and the value of them. The SACRR focuses more on clinical reasoning and a student's sort of thought process in approaching problems. So they had both the experimental and the control group take these surveys prior to and then after the elective experience. And what they found just with these results was that there was a significant difference in the scores and the change in the scores between the experimental and control groups for the IEPS, so that interdisciplinary education perception scale, and the SACCR, which is the one focused more on clinical reasoning. So I, although not really surprised by these results, thought they were very interesting. In my experience personally, I think that having the opportunity to actually work in interdisciplinary teams, especially in the free clinic setting where you're taking care of patients, is a very valuable experience and really changes sort of how I viewed healthcare. So I wasn't necessarily surprised by the results, and I think that they're very sort of thought-provoking in thinking about how we could formalize this into medical education, this more like real life experience. So the next study sort of focused a little bit more on the service learning aspect in terms of like medical student aptitude. So this study was done at the University of California in San Diego. So they also had a service learning elective that involved student-run free clinic volunteering. A little bit of background on the University of California, San Diego. So they are one of the largest and oldest and most well-funded student-run free clinics in the nation. They actually operate every single day of the week and have an army of providers that volunteer their time. So a little bit of a different scale than what we see here at OSU, but I still think that the information that they studied is valuable. So they had a very large sample size, much larger than these other studies, with an N of 433. And they had students take this questionnaire that had 9 components, and they had different questions related to knowledge, skills, attitudes, and self-efficacy. They focused a lot on work with homeless populations and other underserved communities in particular. And they found that when students took these surveys prior to the elective and then after the elective, there were significant differences in all 4 categories after their experience. So sort of like the other one, this isn't completely surprising because they're getting real life experience working with these populations. So you would expect them to be more confident. But one of the very interesting findings of this study was students were actually more likely to say that they were interested in a primary care career and or working with underserved communities in the future. So there's also something to say that this could influence some medical student decision-making in terms of career choice. So the last study, this is the one that's my favorite, was done at Sidney Kimmel Medical College and looked at sort of physician empathy and burnout. So a very big hot topic in medical education and just medicine in general is this physician burnout. There have been many studies that have documented kind of the decline in empathy of medical students from their first year through their clinical rotations. So this study used the Jefferson Scale of Empathy, which has been validated in previous studies, and had Students fill out these surveys and divided the students into two groups. So there was a group of students that had volunteered at the student-run free clinic, and then there was a group of students that hadn't. The group of students that had volunteered, so that N equals 85 on your chart, included both sort of steering committee members, the leaders of the student-run free clinics, and also included anyone that had volunteered. They found that after giving the questionnaire, the Jefferson Scale of Empathy, they gave it in the first year, and then they gave it in the third year after conclusion of clinical rotations. And they found that both groups had some decline in their scores. However, only the non-volunteer group had a significant decline in their score. Now, as you'll see in that chart, the scores between the volunteers and the non-volunteers differed by not even a point. So the actual clinical significance of this statistical significance is questionable. However, I do think it's interesting to consider when thinking of ways to sort of mitigate this medical student decline in empathy, which has been linked to later physician burnout, that student-run free clinics and service learning could be a possible way to mitigate that decline. All right, so there's been lots of talking, but these are kind of my last few slides from my survey of OSU Comm students to just gain their perspective of their free clinic experience. So once again, this is not gynecology clinic specific, but is rather kind of free clinic experience in general. I was lucky enough to get about 55 of my classmates to complete these surveys, so an adequate sample, I would say. I only included third and fourth year students, so I wanted to include those that had been involved in clinical rotations. So the first one is, how many times did you volunteer at a free clinic? As you can see, over 50% are big time volunteers that have volunteered over 10 times. But I do think it's interesting that over a quarter volunteered less than 5 times. So I do think that this data actually has a little bit of it shows different perspectives rather than just being only the student leaders. So the first question was, how impactful was this experience on your future career choice? So my scale was not the most scientific, but I went from no impact to 1 to it changed my decision of what to do with my career after medical school as 5. So I thought it was interesting that quite a few, almost 50% of students marked 4 or 5 as their most impactful. So I would say that's in the very impactful category. The next question was, how impactful was this experience on your view of how social determinants of health impact patient care? And this was overwhelmingly noted to be very impactful, or the second to most impactful, which is not surprising knowing the population and sort of the interdisciplinary models that we see. So this question actually gets at that interdisciplinary model. I ask it because I was curious. We do have kind of structured interprofessional events that we have as students, and I was interested to see how many students in their volunteer experience had actually worked with other students, and almost 91% of them had said that they did. I think that the comments were some of the most impactful to me personally. So I highlighted a few of the comments that I liked the best, but I think that things like hearing that it helped prevent burnout, that it was a rare opportunity, and when they talked about it on residency interviews, program directors were really impressed, saying that it was a critical part of their early medical education and that it inspires them for their career in medicine. I think these are all doctors that we need in the workplace, and so I think that it's clear that for the majority, or at least those that responded, volunteering at the free clinic has had a positive impact on how they view the healthcare system, and then also how they see themselves fitting into it and helping to serve patients. So I'll just conclude with a few thoughts. The first one being that there are many barriers to obtaining routine gynecologic care. So we talked earlier about sort of the different community resources that are available to help all patients access the gynecologic services that they need. There are many of them, but whether it be previous history of not great experiences or finances, transportation, lack of flexible scheduling, all of those things all make gynecologic care and just medical care in general hard to access for some. I think that our clinic over the past 3 years has proven that student-run free clinics can provide quality gynecologic care to underinsured patients, and that we can be in that group of community organizations that can be available to patients. I think that based on some of the research that I shared, that student-run free clinics provide a unique training opportunity in interprofessional collaboration. I think that, that Medical University of South Carolina study that I shared that had the elective paired with the student-run free clinic service learning. I think that right now at OSUCOM, we have the sort of clinical skills and lectures and activities component of that. But I really think that the student-run free clinic experience is very valuable. It's much more of a real world. It is a real world situation where you're trying to take care of patients. And so I do think there's a lot of value in that. And then finally, it sort of transfers into my final point of that student-run free clinics could play a role in formal medical education. In addition to helping to serve the community, I think that there's a lot to be learned from the patients that you have the opportunity to take care of in these settings. So I included my references there. I wanted to make quite a few shout outs. So Caitlyn, who introduced me, and then Julie, they were my go-to people when we first started this clinic, along with Dr. Cooper. And then the 3 student leaders that have come after me were very helpful in creating this presentation and keeping me updated on what's going on. And then I'd be happy to take any questions.
Looks like there's a question here. The question is, were there any unexpected or surprising roadblocks you encountered when starting the clinic, and any surprising allies or people who helped get it off the ground?
Yeah, so I think in terms of surprising roadblocks, I think it was more of just the logistical challenge in general of trying to make sure that nothing falls through the cracks. So I think it was creating a system to make sure that all the lab results are in the right spot and everything's followed up on, and making sure there was one point person that was responsible for following up on that. I definitely didn't know how to report to the Ohio Department of Health. So that was something that I learned very quickly how to do and why it was required. And I think some of the questions were surprising. They weren't necessarily roadblocks, but learning how to communicate different lab results to patients. For example, like an HPV positive result on a normal pap smear. Learning those sort of intricacies was definitely a quick learning curve when we first got started. In terms of surprising allies, I know I mentioned it in the presentation, but the social work team was so crucial to everything that we did. They see every single patient that we saw, especially at the very beginning, whether it's insurance or food stamps or trying to get patients connected to counseling or psychiatry services. It was definitely absolutely necessary to have them be so involved. And we're lucky to have them.
I think another thing that's really fortunate is we had the space. If this idea had just come out of a conversation and we had to start from the very ground up, I think that would have been a huge limitation, but we were really lucky that we had the facility and the connection with Ohio State to just kind of spin off of a clinic that already existed. We had the bones.
Mm-hmm. Absolutely.
Are there any other questions that anybody has? Shannon, what advice would you give to M1s or even prospective medical school students who think that this sounds great in theory, but are going, oh my gosh, how do I balance that with my academics and all of the other things that medical school pressures me to do?
Yeah, so I think that's something that we probably hear quite a bit, is not wanting to take away from grades or studying. I would say that for me, at least, the free clinic was where I went to remind myself that why I wanted to be a doctor. The studying days can get really long. And so I think that not being afraid to take that sort of time to remember why you did it in the first place is important. I also think that I become more effective when I have more things to do. So not being afraid to sort of take on those additional responsibilities, because I also think that they'll benefit you in the long run. I think most of the people that volunteer at a free clinic can speak to sort of the good feedback that you get on your third year clinical rotations of physicians are impressed by how you can communicate with patients and explain things in your bedside manner. And I think that just comes from more practice and being put in some of the challenging situations that you come into at the free clinic.
To learn a little bit of the art of medicine, right?
Yeah, exactly.
Free clinic where you did your first PAP?
Yes.
I find that almost every clinic we have it. At least I have a student that it's their first opportunity. So if there's any educators or faculty who are watching this, it's also a really good opportunity for teaching to slow it down and really go through the essentials of that clinical exam and teach fundamentals that will be carried on for a long time to come. So that's always a cool piece that I think that we get to teach and be a part of in the clinic. It does look like there's one more question. What advice would you have for starting a new GYN clinic at a different OSU College of Medicine free? I think maybe maybe it needs
a different free clinic,
like another specialty clinic, perhaps.
Like a gynecology clinic at a different clinic.
Well, I guess that would be a good version of this question is what would you, if you were starting this at another place, what would you advise? And if you were trying to start a specialty clinic, we don't have, can you comment a little bit on how those have gotten started and like what the process has been for those?
Yeah. So I think the biggest thing is just having drivers behind it. It does take like a decent amount of like legwork because you have to have all your protocols in place. So you sort of have to have a plan for every unexpected thing that can happen. So if there's an HIV positive result, you have to have a plan for that, even though like we've never encountered that in our clinic necessarily. So I think all of those plans take time, but so that's why I would say the first thing you need is like a motivated student, but you also need like a motivated provider. So Caitlyn and Julie were those providers for me, and you need someone that's just as dedicated to it as you are. I think the other thing is the planning for the unexpected, I think is very important. And then just making sure that you have interest, not only in the community, but interest in like the provider and the student volunteer piece, because none of that can happen if you don't have enough people to actually see the patient on an everyday or an every clinic night basis. Those would be kind of the three things that I would say to start with. And then getting into sort of the more nitty gritty of obviously having the space first off and the ability to do labs and all of that sort of from the get-go.
And I have seen this be done in other places since we've started. And I think that's been what they've been able to use is like an anchored free clinic. And they've most often spun this off as a specialty clinic, not a standalone.
But I'm happy I know we're happy to provide any documents or anything that we can, any like protocols or templates or anything to help anybody else interested.
And then you can correct me if I'm wrong. The other specialty clinics, as you said, have kind of been a mirrored version of what we've done here. There's been a provider that has a particular interest or specialty that is either on the board or comes to the board. And then those board meetings behind the scenes are where those are discussed and the teams are really kind of laid out and plans are put together from there.
Exactly.
We're really lucky to have both urology and psychiatry because those are both specialties that we're using to refer to out of the Women's Health Clinic. Are there any other questions that I'm not seeing?
I believe that the QR code will provide like a feedback form for me. So I'd be happy to hear all your feedback as well.
Looks like there's just a comment. It says no question, just grateful for you both and the hard work to get the GYN clinic off the ground. Well, thanks, Shannon.
Thank you, Caitlyn. I appreciate it.
I'm happy to answer any questions anyone would have down the road. My email address is just caitlyn.hall@osumc.edu. So if you want to talk to me, I'm happy to talk at any time. And I'm sure Shannon's very open to do the same.
Yes, absolutely. My email address is not changing. So I'm just Shannon.Weber.
Thank you both so much. Shannon, that was an incredible presentation. And Caitlin, thank you for providing your perspective before and during the Q&A. Our next medical student grand rounds will be held on Tuesday, April 20th at the same time, noon. The link will be available to register a week in advance, so stay tuned to our Twitter and website. And Wendy Oslach will be presenting that day, and she'll be presenting about the importance of sustainability in medicine and the effect the environment can have on health. So we hope you join us for that. And then thank you again to both of you for joining us today. And to all of our lovely
opportunity.
viewers.
Appreciate it. Bye.